Hi y'all. So 5 things to know about anemia during pregnancy. I'm Dr. Fatou Forna. I'm an OBGYN who works to keep pregnant women safe here in the US and around the world. So anemia is a big issue for pregnant women. It's also an issue that affects Black women more. The reason is Black women are twice as likely to be anemic during pregnancy. So I want to talk about anemia and let you know, some things you need to know about anemia. First, number one, let me define what anemia is. Anemia is when your red blood cells are low in your body. The red blood cells carry oxygen in your body and in your blood, and so they take that oxygen, that you breathe in, they take it all the way through your body and pass it on to the baby. You can get more anemia during pregnancy. So most women become anemic during pregnancy for a couple of reasons. Your blood volume increases during pregnancy, so you make more blood, and because of that, you need to make more red blood cells to kind of keep up. Your baby also draws from the iron that you have in your system, because the baby needs iron to make their own red blood cells. So because of that, you have a higher demand for iron during pregnancy. You're more likely to be anemic during pregnancy. We check for anemia a couple of times during pregnancy. We check it at that very first OB visit. We will check for anemia. We also check it around 28 weeks of pregnancy in the 3rd trimester. And then we check for anemia right when you go into labor, when they're drawing your blood to kind of see where you are. We use numbers to discuss how anemic you are. A normal hemoglobin is around 12 or 13 or so for most people. But when your hemoglobin level drops to be less than 11, then we say you're anemic. Or your hematocrit, you might hear a hematocrit number. When it's less than 30 to 33 or so, then we say you're anemic. Now, number 2, the second thing you should know about anemia is that they're higher, when you are anemic, you are at a high risk when you're pregnant. You become higher risk. The reason is postpartum hemorrhage, or hemorrhage in general, is one of the major killers of women, one of the major causes of maternal mortality. Heavy blood loss after delivery is called postpartum hemorrhage. Again, that's one of the top causes of maternal death. And as usual, Black women are at a higher risk of postpartum hemorrhage. You are less likely to die if you have a postpartum hemorrhage and your blood count is normal. So Black women, it would behoove you to enter pregnancy with a very high blood count. You need to, not pregnancy, enter delivery. You need to enter delivery with as close to a normal hemoglobin level as possible, because when you enter and you're high and you lose blood, then you are going to be okay, or you're more likely going to be okay. If you enter time to deliver and you're already very anemic and you don't have much blood in your system and you bleed heavily, then you're going to be in trouble. You're going to be more at risk of your heart stopping. And if you don't get blood quick enough, you're going to be at risk of dying. So don't mess around with anemia. It's a life and death issue. Black women, make sure you are not anemic because this is a preventable cause of maternal death. Number 3, anemia can pose higher risks for baby. The baby, I talked about why the baby needs the iron and to make their own blood so they're not anemic. Pregnant women that are anemic are more likely to have low birth weight babies. They're more likely to have preterm deliveries, going to labor early and deliver a baby that's premature. And because of these things, they're more likely to have a baby that dies after delivery. So they're higher risk for mom, they're higher risk for baby. Number 4, the 4th thing you need to know about anemia is that oral iron can help to prevent anemia. You can get oral iron that you take by mouth through different sources. Number 1, you can get it from foods that are rich in iron, as spinach, broccoli, red meat, things like that. So you need to be eating more of those when you're pregnant. But usually pregnant women need some extra iron, and you can get that in your prenatal vitamin. That's why it's important to take that every day. A lot of Black women also need to take at least maybe 1 extra iron tablet a day. And then if your doctor finds out that you're anemic, you might need more. Number 5, The fifth thing you need to know about anemia is that we now have intravenous iron, an IV iron infusion that can help to treat anemia. If you are very, very anemic early in pregnancy or in the third trimester, definitely in the third trimester, if you're very anemic, it's typically you're not able to bring your iron levels in your body up just by taking tablets or by eating. I see a lot of women who are resistant and say, oh, I'm just going to eat more of my veggies. It's just not enough for what you need. The demands of pregnancy are too high. So in the third trimester, if they check you and you are anemic, ask your doctor, am I a candidate for IV iron? Because it's difficult to get enough by mouth. And this is something the American College of OBGYN recommends, that if pregnant women are anemic in that third trimester, then you need to give them IV iron. So Black women, anemia is a big, big issue, but it is a correctable and treatable issue. And correcting your anemia is a critical strategy to preventing maternal death. So talk with your doctor about anemia. Make sure you're taking your iron tablets and your prenatal vitamins. And if you're anemic in your third trimester, ask your doctor specifically, am I a candidate to get an IV iron infusion? Because we need you to survive and thrive.